Hey, everybody. See who can pick this out. If you guessed Bruce Springsteen doing The Clash, you are correct. And we're playing it in honor of our guest today, Gina Giamboni, who is a big Bruce Springsteen fan and is someone that I had a chance to meet last year when I was in Las Vegas, and who made a huge impression on me. And then just, I guess, as fate would have it, got in touch with me this week to check in on me when really I should be checking in on her, and made me think it'd be great to have her on the live stream today and have her share her story. And as I was going through her Instagram feed, saw that she's a huge Bruce Springsteen fan. So that's where our two worlds, Gina, come together. Bruce Springsteen, Joe Strummer, the boss in The Clash, him playing Clampdown. Hope everyone's good. This is the 1st of April, traditionally April Fool's Day. I don't know if anybody is feeling like April Fool's Day or playing a prank, but Amy just got me with a really good one. She's making a list for the grocery store, which she's about to go to, and she said, is there anything that you want to get? And I said, well, we should probably pick up some more beer. And she said, well, you didn't hear in the governor's order yesterday, they are no longer going to sell alcohol in Texas, no more beer, wine, spirits going forward. And she totally got me, because it was just so crazy that maybe it was true. And turns out that was her April Fool's joke. Our oldest son, who was on a Zoom call today with the rest of his class, they got pranked. Somebody got the code to their Zoom call. Stranger jumped in on the call and completely interrupted the class with a somewhat funny and then somewhat indecent stream from his living room or his bedroom. And Ulysses just showed me a clip of that. So our apologies to the Wiggs Middle School teacher who had to endure that, but I heard that you did a good job of muting the interloper and protecting everybody in the class. Hope everyone is healthy. Hope you're staying at home. As Samuel L. Jackson would say, stay the fuck at home. Don't leave your house unless you absolutely need to, unless you work in an essential job. Obviously, those in the healthcare, those who are providing healthcare right now, I was going to say the healthcare industry, but those who are providing healthcare, doctors and nurses, the cleaning crew who make sure that that hospital is safe and clean for the patients and the staff that works there. Those who are working in supermarkets, stocking shelves, ringing up our purchases, those who are at the food banks right now, those who are out in first responder jobs, police officers, firefighters, everyone who has to go out there and work, we're with you and we're grateful. And we are sending you health and wellness and strength and courage as you do your job. And we want to make sure that you do not become infected with coronavirus. And the best way that we can do that is to stay at home and not go out unless we absolutely have to. Go to the grocery store, walk your dog, keep more than a 6-foot distance from any other person that you see, take a hike in the hills if you live in El Paso, or out by the beach if you live by the ocean, or out in the woods if you live in one of those places. But don't come close to other people. And then also don't go to the emergency room unless you really have an emergency. Let's save that space, that capacity, those beds for people who really need it. And we know that we have come nowhere close to the peak of this pandemic, and that the stress and strain on our hospitals is only going to become greater. So keeping that in mind, please do the right thing and stay at home. Couple of quick updates. I think today is Go Fill Out Your Census Day or something like that. And you can go to my2020census.gov, my2020census.gov, and you can fill out your census form, and you can do it from home, which is extraordinarily convenient and absolutely necessary in these times without waiting for somebody to knock on your door. And not only are you doing the right thing, not only will we as a country have an accurate count, but your community is then going to get the resources that it needs to make sure that everyone is okay. Your fair share is dependent on your willingness to fill out the census form at my2020census.gov or .gov. I'm going to try something. Our co-producer, Elizabeth, who's been giving us the numbers on coronavirus cases in the U.S., just gave me the latest update. This is from the Centers of Disease Control and Johns Hopkins. I'm trying to make sure that I give consistent numbers or consistently sourced numbers, reporting more than 209,000 cases in the United States. Globally, I think we're close to 1 million. There it is actually on the screen, right under 930,000 cases globally. So look at the significant share of those cases that are right here in the United States, almost 210,000 of them. More than 4,700 Americans, human beings, moms, dads, brothers, sisters, grandparents, have died so far that we know of. And that's a really important point because we don't have testing in this country, can measure it with the demand and the need of a nation of 327 million people. So really, we don't know. These are the officially reported numbers. They're an indication, but they're really just a fraction of what's really out there. But so far, we know that just under 5,000 people, human beings, people who are important to those in their lives, have lost their lives so far. In Texas, we have just under 4,000 cases reported, and in Texas, just under 60 deaths reported so far. So, Elizabeth, thank you for that information. Again, globally, we're just about to surpass 1 million cases reported. Now, again, the unreported cases, that number is much, much higher than what we're seeing officially reported through the governments of the planet. And as soon as we get more tests, we'll have a much better idea. We'll be able to trace the contacts of those who are infected, isolate those who are infected so that they do not spread this, as they have successfully been able to do in some parts of the world. I think about South Korea, I think about China, and in some states, I think about Washington State and the wonderful job that Governor Inslee has done there so far. So it's a quick update on the numbers and the facts. Last thing, I think there either was or is currently a press conference with the President of the United States, Donald Trump, because he so often traffics in lies at those press conferences, because we can't trust what he says. Our thanks to every press outfit that is not carrying them live and is instead doing the fact checking before they present that information to us. And our thanks to everyone who's just sharing the real data sourced from reliable places like the Centers for Disease Control, like Johns Hopkins, which is what we are trying to do here, as well as bringing guests to you, like the doctors and public health experts and epidemiologists that we've had on the show the last 2 weeks, who can answer your questions and make sure that we have the best information to make the best possible decisions for ourselves and for those in our lives. Perhaps the last thing that I want to share with you is, I mentioned it's April 1st, first of the month. Rent is due for tens of millions of people across this country right now. Never been more important for us to look after one another. That means to every landlord out there, making sure that if your tenant is unable to pay the rent, that you do not proceed with eviction notices. I know some states have provided some kind of forbearance or delay before eviction can take place. We are urging that those eviction plans are shelved for the foreseeable future until we get through this. And then in the meantime, those who are at risk of eviction get the direct aid and cash payments and help that they need to be able to afford housing, to be able to afford to put food on their table, to be able to afford the medications that they and their kids or their parents or those in their families need. This is not a time to push anybody out onto the streets. And so our gratitude to everyone who is being kind, being thoughtful, doing the right thing, and our request that everyone who has not yet thought about this do the right thing while there's still time. So let's make sure that people can stay in their homes, put a roof over their head. All right. With that, I'm going to try to bring on our guest, Gina Giamboni, who I met in Las Vegas at a town hall meeting sometime last summer. Gina might remember the exact date. I met Gina and her daughter Summer. I believe Gina also has a son who is deployed right now, serves in the United States military. And we were having this town hall meeting where I met Gina and her daughter. And I may ask Gina if I can just tell the story about when we first met and what that was like and the question that she asked me. And then I want to find out how she's doing now and how the people of Las Vegas, Nevada are doing. So with that, we're going to see if we can make this work. Gina, please be patient. Here we go. All right.
Hello.
Hey, Gina, Summer, how are you all?
We're great. Can you hear us?
I can hear you loud and clear. Could you
Great,
hear the Bruce Springsteen that I played in tribute to you?
Yes, I knew it was Bruce right away.
So I was going through your Instagram feed, which, by the way, is amazing. And I saw lots of pictures of you and Summer at Bruce Springsteen concerts, some of you with him. How many times have you seen him?
Couple hundred.
No.
Yeah, 270, I think.
That's amazing. And if you don't mind me asking, what was the
I
best
quit counting.
Bruce Springsteen show that you've ever seen?
The best. Madison Square Garden, the River Show.
What year?
And that was 2016, I believe. It was the Frozen River Show. No, I'm sorry. I'm wrong. It was 2009, Madison Square Garden. He played the River full album.
Right on.
That was probably the best. And then there was Paris and Australia and Sydney and New Zealand, Germany, Italy, Milan. I take that all back. Milan. That was probably the best. Yeah.
That's amazing.
Yeah.
I didn't know this. I didn't know this about
Milan.
you. That's really amazing. And so, tell us what he means to you. I mean, obviously you followed him all over the world. He's an important influence on your life. What does he mean to you? And maybe what does he mean to you right now, or what does he mean to us?
I think mostly what he means is he's given us a family, a community. He's taken some really messed up lives and made us characters and songs. And he's made, like, for instance, I travel, and he wrote a song, The Wayfarer, and it's about me. Now, it's not really, but
but so it is.
Yeah, he writes songs, and they resonate with us, and we have a huge community. There's probably about 200 fans that I followed him with, all individually, but as a group. And we just met the next show, the next show, the next show, and just followed him for probably about 12 years. It's been, my first show was 1978, but about 12 years of actually traveling and seeing the world.
If people who follow the Grateful Dead around the country are called Deadheads, is there a name for the band of fellow travelers who follow the boss?
Yeah, we're probably tramps.
Tramps.
Yeah.
I like that. Tramps like us.
Yeah.
I love it.
You were born to run like you.
Summer, how are you doing?
I'm doing good.
It's so good to see you again.
Good to see you too.
Yeah.
I'm
Gina,
checking her constantly.
Yeah. Gina, would you mind if I shared how you and I met in the question that you asked me?
Sure. Go right ahead.
We were at a town hall meeting in Las Vegas. I was a candidate at the time. We'd had a good town hall meeting, answered questions, talked about what we all thought was most important that was happening in the country. And afterwards, you were so kind and took time to come up to me and introduce me to to Summer and tell me a little bit about yourself. And the question that you posed to me has always stayed with me, and it's one that not only do I want to try to answer, but one that has been a spur to me, and I hope to others, to try to do better in their lives so that this country does better for everyone. And you told me that at the time you were working 4 jobs, one of which was to help take care of Summer. The other jobs essentially involved delivery services like DoorDash and Uber Eats, where you were picking up food or items for delivery and then driving across town or maybe into another city altogether and delivering them for the people who had ordered them. And your question to me after you had shared that with me is, you said, you know, a month's rent in Las Vegas might be, and I can't remember the exact number, it might be $1,800, $1,500. And in order for me to rent an apartment for my daughter and myself, I have to have a full month's rent as deposit, and then I have to have the first month's rent to pay. So that might be $3,000, $3,200, $3,500. And you said, I just don't have it, though I'm working 4 jobs and working all the time. And you told me that you were sleeping, the two of you were sleeping in your car. And your question to me after you told me all of that was, why is it in Las Vegas that it's illegal to stay in your car? Not why am I not paid a living wage? Why is housing not a basic human right? Why is it so hard to be able to provide for those who live with disabilities? It was just this very modest, humble question of, why am I not allowed to live in peace in my car? And so I want to ask you, Gina, since I saw you over the summer, tell us about what you have done since then, where you're living now and where you're working, and how you all are able to take care of one another.
Well, the first thing was, nobody knew I was living in my car. That was a very personal thing. But once they found out, I had a friend's son who was renting a house offer me to rent a room there until I could, find my own home. And so I did. I've been renting there since we last met. And on the 1st of March, actually 28th of February, my sister called from Mississippi, and she had an emergency situation and needed me if I could give her a ride. And I said, of course, I'll come get you. And that was right before the breakout. It was in China, so we left. We didn't even think about it. And we rushed off to Mississippi to rescue her.
You drove from Las Vegas to Mississippi? To
Mississippi through El Paso, because I wanted to see the wall that they don't need. And so I went and got there and got her and took her up to Ohio. And the whole way across the country, I could see in people's eyes who had like a fever going and stuff. And we just kept on, we were laughing, thinking Captain Trips, we weren't really taking it serious because, Donald Trump, I don't call him my president, but he was saying, oh, don't worry, don't worry, don't worry. So no one was taking it serious, but we had seen it in China, so it was kind of like we were just pointing it out. Oh, he's got it, he's got it. And when we get to Ohio, right, and I also have another daughter that you didn't mention, but she lives right in the middle of, there were three confirmed cases, and one was in the hospital doing really, really bad, and it was right there. And I dropped my sister where she needed to go, which was right there. And all of a sudden I realized, because we only have insurance in Nevada, I realized I needed to get Summer home because she's very high risk. She has constricted pulmonary artery, severe stenosis. She has a hole in her heart. She's very susceptible to pneumonia. And my first thing was, when I really realized it was real, I had to get her home in case we needed a doctor. case we needed the hospital, because I have traveled a lot and they don't see you in the other parts of the country if you're insured in Nevada. I mean, they'll see you if you go to emergency room. No, but so I got her home and we were a half hour outside of the city, and I get a phone call from my roommate, and she just delivered her baby in our bathroom. So there was no way I could go home because I knew I had been exposed all over the country.
So they had a newborn. You were
Yeah.
coming back from an area where there was infection. You worried that you might be contagious. You might have unwittingly brought that back with you. So
Yeah,
you
and
weren't
there
going to
was
go back
no
to this
way.
house.
No way.
So how did you find a place to stay?
Well, luckily, I have a membership with the Jockey Club. It's like a timeshare thing, and you get points. And so I immediately called. So I got to see if there were any openings. And of course, it's March Madness, and the town is booked solid. There's no way. And I'm like, what am I going to do? And boom, right then, the whole town shuts down. People are canceling. So I called up the Jockey Club. They said, yeah, they could give me a room. So I took the 2 weeks for my quarantine and dipped in because I've been saving, need to move into an apartment, and so, but I took the money, got the room for 2 weeks, and now we're locked down for another month. So I went to find an apartment and I was turned down because of my rental history, even though I have really good, well, not great, 650 credit, no evictions. I have enough income to prove, we have to prove 3 times the rent. So if you pull everything together, we could probably prove 2 times. But anyhow, we got turned down. So I just went and got another, from the Jockey Club, the same group of the RCI. I just went and got another room for a month. So, and that was, all my points that I've been saving also, because every year we get to go on a nice vacation because we have points. So we're going to vacation in shut down Las Vegas. But I did make a call.
Yeah.
Oh, go ahead.
Well, I wanted to ask you something about housing, and then I actually want to hear what's next for you in housing. But there was this New York Times article that I read today about how Las Vegas is responding to the need for housing or the need for shelter for homeless at a time of coronavirus, because one of the shelters in Las Vegas, there was a case of COVID-19. They were worried about the other clients at the shelter. And so let me read this to you. You know this, but I'm going to read this for everyone who doesn't.
Okay.
The casinos are deserted and thousands of hotel rooms are empty. But when the city needed a space for a temporary homeless shelter, officials chose an outdoor parking lot. More than 6,500 Las Vegas residents lack permanent housing, and nearly 70% of the city's homeless population sleeps outside. That's according to the Las Vegas government. And it's hard to think of another place on planet Earth that has more available hotel rooms right now than Las Vegas.
Here.
And it begs the question, can the hotel or property owners themselves open those rooms up to people who need them at a time where people should be isolated and not congregating? And or could the government, maybe through the Defense Production Act or some variant thereof, requisition those rooms that are now open? Nobody's going to pay for them. Nobody's traveling to Las Vegas, to make sure that people who need a roof over their heads and need to be isolated from other people have a room or a house or a hotel room of their own. Tell me what you're hearing and what you're seeing in Las Vegas, and make some sense out of this for us.
Let me just show you out my window. Can you see that?
Yeah.
Okay, and that is only two blocks. That's 2 blocks in Las Vegas. We have miles and miles of resorts here, miles. And I sit here at night, and every one of these are black. There's not a room rented.
No lights.
And I don't know what's on the one I'm in, because we're the only semi-residential, because of it being a timeshare thing. It broke my heart. I called originally when I knew after 2 weeks I was going to need to find a place. So I called one of the shelters and I said, I'm not sure if we've been exposed, but what are you doing for people who, is there a place I can call that will I have the money, I have the deposit, I have everything they're asking. I just can't go out there and find a place. I can't. You cannot go and find a place to live. They're just not in their offices. There's nothing, and I'm not going out anyhow. But they told me I could come down to that shelter and stay on that roof with my daughter. And now let me also tell you something else about that. It's maybe 2 blocks, maybe a block away from an overflow for corona patients.
Really?
So we know it's airborne. Now you can't go to the shelter until 5:30 at night. You can get in line. At 8 a.m., let's say you were breathing it in and got a little exposure. 8 a.m., you have to be out of the shelter, on the streets, and hidden because it's illegal to be on the streets right now. So they take all these 500 men or whoever they have sheltered, and they put them out on the streets at 8 a.m. to hide until 5:30 p.m. when they can come back and get their spot in a parking spot.
On the roof of a parking garage, right?
On the roof. While Caesar's Palace sits here, 15,000 rooms. Madison, help me out. MGM, right here, the Flamingo, Bally's, Bellagio, billion-dollar places, and they can't help even protect themselves because the homeless are now just gonna have to walk around. They have no choice where to go. I am so fortunate to have a car because I considered myself actually a good life and had it good for the few months that I had it rough. I actually left where I was at specifically because I had an abusive roommate. And I didn't want to live in abuse with someone yelling at someone when I wake up. If there's no peace, anyhow.
Well, so I want to ask this of you, Gina. So you thankfully, as you said, have a roof over your head. Summer, who is one of these vulnerable populations that we hear about, who has underlying conditions and should no means be exposed to anyone who might have coronavirus.
Right.
You all have a place to yourselves right now, but it sounds like it's not a permanent solution.
No, just for a month. We have it for a month.
So what happens after this month
1st.
is up?
I'll figure it out. We'll be okay. But I'm going to be looking online, and stuff for a place to rent. But I am not afraid or at all afraid, maybe a little bit, to go into my car and to drive out of a town and sit at the base of a mountain where no one can breathe on me. Because I can't. Well, first, I'm seeing that you can get reinfected. Now, when we came back, Summer, I had to take her to the emergency room because I had symptoms the whole time coming home. So I knew it was in my chest right here, and I would cough it up. It was a mucusy, yellow, cottage cheesy, but it didn't dissolve when well, anyhow, sorry. Graphic details.
That was very graphic, Gina. But
I know.
But it
I
helps to
know my
understand the
body, and
symptoms.
I'm sorry. I know what I had. It was not my usual anything.
Right.
It wasn't the flu. But when Summer started coming down with the symptoms, I knew that her eyes are starting to look red, and that's starting to bother me. But I knew there was something. But about the 3rd day, she was having trouble breathing, so I took her to the emergency room, and they treated her for congestive heart failure, pneumonia, a viral upper respiratory infection, and the COVID-19. But they never tested her. And we went home with instructions to self-quarantine. And tomorrow I am done with 14 days of my symptoms, or yeah, 14 days after my symptoms, but she's not. And I don't know if I have to restart counting once her symptoms are gone.
Summer, how do you feel now?
Sluggish, tired,
Uh,
congested, and stuff.
trouble breathing?
She doesn't seem to have trouble breathing right now, but I'm keeping an eye on her but originally we called the hospital up here, and when I mentioned what insurance we have, they said, "Oh, we can't take you, go to Sunrise." Well, this original one was testing, and she could have been tested, but they didn't take our insurance. And Sunrise wasn't testing unless you were doing really bad. But
they've rationed those tests. There just aren't enough tests in this country for the need that we have. And
right.
We've talked to doctors often over the last 2 weeks on this Instagram Live, and they're telling us that almost everyone they see, now this is in New York City, that's coming in right now is COVID-19. Even people who don't initially present with the symptoms, who may come in for a broken leg or an abdominal mass or whatever, they end up doing a test and it's COVID-19. So it's spreading much faster than we are able to test for right now. Gina, before I let you go, I've mentioned at the outset that you have a son in the military who's deployed right now. You also mentioned that you have another daughter. How is the rest of your family doing?
They're okay. My daughter she gets in touch with me quite a bit. She is a hermit anyhow, so she's totally cool with
she was made for this
lockdown. She was like, yeah, don't have to see anyone. Yeah, but now my son, I worry because, well, first off, the thing I don't worry is because I never gave him penicillin when they were growing up. Being low income, you have to choose where you use your medicine. And my kids were raised on their own immune system protecting them. So I do have that, the peace knowing that they've always fought everything off well. But I worry because my son, I don't want to say where he's at and stuff, but he is overseas. And the place he just left to go home to his other overseas duty, because they have to go every once in a while to another place. But where he's stationed, the place he went has just come down with it, the military base, or the area where they were. And I asked him, he said, he's fine. But he's always said he's fine, don't worry. But
right.
I'm not worried about that. I think that if not to seem religious or anything, I'm kicking it up to another level of defense, and I'm going to go with some spiritual warfare, because they're talking 200,000 to 2 million people dying. And all I just remember the Exodus and the Passover, and to put the blood of the lamb on your door, on your mantle, and the angel of death will pass you by. And I'm just holding on to that, because we went to the doctors, they sent us away. We've gone, no one's helping us but God, right down, when it comes right down to it. If it's, that's just how it is, and there's no way we're going up on the roof of the parking deck. So,
one thing that struck me when I first met you, and is reinforced by watching you right now and listening to you, is just the extraordinary strength that you have, and your fierce, unbreakable determination to see this through, whatever it is that's in front of you at the time. And right now, it is the greatest pandemic threat that we faced in 100 years. It's the health and well-being of your daughter, yourself, and I guess your family in other parts of the country and other parts of the world, and probably those who are closest to you in your life. And in what you just said, and how that determination comes through spiritually or through religion, how it comes through in your ability to acquire housing when you need it, and make sure that you're not out on a rooftop parking lot, which is fucked up, excuse my French.
It is.
That we do that to our fellow human beings now of all times, right? When people are desperate for help and care and medical attention, that we would do this to our fellow human beings in a city that has more hotel rooms per capita that are now empty and available for use by those who need it. You really inspire me, and I know you inspire people who have met you or who have heard your story. And it's why I'm so grateful that you and Summer would take some time and share your story with us and tell us how you're doing, and make many of us who've gotten to know you and care about you feel better knowing that you're okay right now and that you will be okay going forward. You've got my cell phone and you got in touch with me recently. I hope that you will continue to stay in touch with me. Reach out if we can ever be of help. We want to be there for you. And I know that I speak for a lot of people who have been inspired and captivated by you. So I just want to say thank you for joining us. We wish you both well. Summer, it was so nice to see you again. And
nice to see you too. Thank you.
We'd love to check back in before too long and just see how you all are doing. Is that okay?
Anytime. And take care of your beautiful family.
I will. Absolutely. Thank you all. Have a good one.
Bye-bye.
Bye-bye.
Bye.
Thank you. God bless.
God bless. Wow. That's one of the best conversations I've had in a really, really long time. I think about Gina and Summer all the time, and I have ever since I met them, wondering how they're doing. Every now and then we will text each other and check in on one another. And again, it was Gina checking in on me this week, not the other way around, which I'm just so grateful for. And it made me feel so good when she did. She said, hey, I just want to make sure that you're okay. I want to make sure that you get tested if you need to get tested. I want to make sure that you stay healthy. And as we had an exchange and a back and forth, I just thought it'd be wonderful to be able to see her and to hear from her, and who have met her before or heard me talk about her before. So Gina, Summer, thank you so much for taking the time and for being on with us. And thanks to you all for joining us. All of you, even the trollish people who are commenting really inappropriately and sometimes just saying wildly stupid shit. But all of you, I love you. I hope you're well. I hope you're safe. Hope you're being good to yourselves and good to the folks in your life. Special programming note. I'm going to see if I can bring this up in a graphic here. Tomorrow, I'm going to be joined by Jim Ward. It's a picture of Jim and I talking in happier times when we weren't secluded and isolated in our homes. For those of you who do not know, Jim Ward is a founding member of At the Drive-In, Sleeper Car, Sparta, has also played solo shows that I've seen him at here in El Paso. In fact, he played a great show for us in Amarillo, Texas during the Senate campaign, and is also, along with his wife, Christine, the owner of Eloise, one of the finest establishments that you can visit and order a takeout meal from in El Paso, Eloise on the west side. So really interested in hearing from Jim tomorrow. What is it like to try to keep your business, your restaurant, afloat at a time that almost every other restaurant in town has closed down? How does he take care of his employees? And Sparta is in the process of releasing an album right now and not be able to tour behind your record, which is what musicians have been doing for as long as records have been putting out, and they've been touring on the road. So how does he reach people right now at this moment? He's also just a lifelong friend, a wonderful human being and humanitarian. He's good people. So I hope that you'll join us tomorrow, 4:30 Mountain Standard Time. That's the time zone that we're in here in El Paso, Texas, 5:30 Central, 6:30 Eastern, 3:30 Pacific. Would love to have you join us in Jim Ward tomorrow. And, okay, last comment, and I hope you all will join with me and direct all of your focus and all of your love and all of your power and all of your energy towards Charlie, our really good friend in Iowa, who I got to know during the campaign, who marched with us in the 4th of July parade, introduced me to the Bearded Dragon, for which she's become famous. And we made a connection because my daughter Molly has a bearded dragon as well named Sandman, and who just became one of our best, fiercest advocates and supporters. Another amazing, great human being. We love her so much. Charlie, I love you. And we just found out that she's tested positive for COVID-19. I've been following her progress on Instagram from a distance on social media as she came down with symptoms that looked like COVID-19, but had a hard time getting tested and then had to wait a while for the results. Cynthia just let me know by text that Charlie has tested positive. So Charlie, we are sending you our love, our energy, our health, everything that we've got to you so that you come through this better and stronger than ever. We're counting on you because there's so much shit that we have to get done this year, and we need you healthy and in the fight. And I know you will be, but I just want you to know that we're all thinking about you and we're all sending you our love right now. And that carries through to everyone in your lives who's struggling right now. If they've lost their job, they've lost their business, they've lost their health, they're in crisis, they're anxious. Let's just make sure that we're kind to one another, good to one another, love one another right now more than ever, right? So love you all. Really great to be with you. Jim Ward tomorrow, 4:30 p.m. Mountain Standard Time. We'll see you soon. Adios.